Steinberg, committee members, thank you very much for giving me the opportunity to testify today. My name is Kristin Jacobson, and first off, I am a parent who has struggled and fought my own battles. I have also turned around and helped many, many families try to navigate this system. I've included lots of material in the briefing binder, so I'm not going to go in depth into it, but I am going to share just a couple of stories to put a face on this problem. This is a picture of Alessandra. She's a 5-year-old girl with autism. Every story I have has happened since the hearing last year. She was diagnosed in 2007 by Kaiser after repeated requests for an evaluation over 5 months that started when she was 18 months old. But no treatment was provided or recommended. Kaiser refused to authorize the ABA until 2011. After 2 DMHC overturns when she was 5.5, that is more than 4 years. 3 years after her diagnosis, 20 months after appealing to the Department of Managed Health Care, and 8 months after the last insurance hearing. 9 months of that was trying to find a doctor to fill out the autism physician questionnaire required by the DMHC only for autism cases, stating that her care had to be covered by a licensed provider. This is Edward. He's a 5.5-year-old boy with autism. I spoke with you last year about his initial fight with Blue Shield, which took 15 months and 2 DMHC overturns to resolve. Despite having resolved the coverage issue and the medical necessity issue, since the hearing last June, his treatment has been interrupted twice for 4 new specious reasons, and this family has had to go to IMR 2 more times, and the denial has been overturned 2 more times.
Independent medical review, IMR.
Because the coverage issue was already decided, and so the only thing left was a number of different various medical necessity denials. One was, you've made some progress, you don't need care anymore. The other was, it's educational, and actually they went back to experimental, and they said, well, let's try again with that one. This is Paul. He's a 3.5-year-old boy, and Anthem did almost the same thing to Paul that Blue Shield did to Edward, and they refused to build a network that had a single provider who met their own licensing standards, and it didn't get resolved until his assembly member personally got involved with the DMHC. This is Annie. The DMHC did find her care to be covered through a standard complaint September of 2010, but Blue Shield has refused to comply with this order for more than 6 months. This is Macklin. He's my son, and I help families full-time, and it took me more than 7 months to even get a denial from Blue Shield that I could appeal to the DMHC. Then they changed the denial reason from experimental to a coverage decision so that it would be not go to IMR, and lawyers would decide instead of doctors. Blue Shield ordered the care to be covered. DMHC ordered the care to be covered, but there was no network, and Blue Shield refused to find a network or find a provider. They provided a false authorization which required the provider to attest that 100% of the hours would be provided by a licensed provider, which is an impossibility. And then they denied and misprocessed every claim despite the authorization. This is a picture of the 10,000 kids who have not received any treatment from autism from their insurance. The denials are systematic. Arriva has already gone through all of them. The state spends hundreds of millions of dollars on this. And when you talk about the 3-legged stool with the regional center, the school districts, and the health plans, the stool has fallen over because there is no 3rd leg at all provided by the health plans. So I told you a story of 5 kids that through extraordinary effort were able to get coverage, but the 10,000 or 20,000 or 50,000 who can't are the people that we need today. And I agree with Arriva, we need significant, substantial insurance reform. Thank you.